Welcome, everyone. You found Sanctuary's Coffee and Conversation Show. I'm Myrna Haskell, executive editor of Sanctuary Magazine. This is an online publication for women that empowers and inspires with a focus on the arts, philanthropy, health and wellness, culture, and community. You can find us at sanctuary-magazine.com. This morning, my guest is Dr. Emily Bobson. She is the owner of Hudson Valley Chiropractic, and she specializes in family chiropractic, pediatrics, and pregnancy. And she serves folks in the Hudson Valley region of New York. Hi, Emily. Thank you so much for joining me today.
Hey Myrna, I think we're on our third one. This is
I
so
think we are. And
getting
I was going to mention that, Emily, because I was going to say a lot of the folks that are probably listening and watching will recognize you because you're a gold sponsor for Sanctuary. As you said, you've been on this program a couple times already. And I did want to mention that our upcoming April issue is our 7th annual Celebrating Autism Acceptance and Awareness. And Emily actually has an Ask an Expert spot feature in there where she's going to talk about chiropractic care for kids on the spectrum. So please don't miss that in our April issue. But today we're talking about women in chiropractic care. So I guess we should slide right into that, right?
sure,
So
yeah.
Emily, you just have so many things that I know that you're an expert in, we can talk about in this issue, but maybe perhaps we just start out generally, women and specific issues to women have health issues and how we feel good or don't feel good and how you're able to help people through those things. Because I know you're a big holistic healer as well, and you treat the whole person. So if you can start from there, I guess.
Yeah. So the filter that I use with women and all people, right, is that right off the bat, I'm not fixing anything. There's nothing wrong with you. What we're working with is what we want to build on is what is right with you and how to make that bigger.
Oh, I
And
like how that sounds.
I know,
That's a
because
good perspective to come from.
it's the perspective that gets the best results, because when you think about how things work, and it's going to get a little heady, you can't get rid of the darkness, by pushing the darkness out. You turn on a light, and the light doesn't get rid of it, it just dissipates because there's light. You can't get rid of like evil by forcing yourself against evil. You get rid of evil by being brighter and shinier and more of, more of a better human, so that that overshadows the evil, right? And
Yes.
so even for ourselves, which again, this is my journey too, working on like how I can evolve and get better. It's like I can't make what's wrong with me go away with force. What I need to do is focus on what's right with me and build on that. So that's the premise of all of it.
Okay. And that's a good place to start with somebody who comes to you for help because I think human nature is that lots of times we do focus on the negative.
And
Oh,
what
this
we
is wrong with me. And then you're so hyper focused on the negativity from that you
yeah.
lose sight of how you're going to pull yourself out of it with the opposite
Yeah.
sort of
And
reaction and approach, right?
the energy that it takes to force something away that you're not liking versus building on something that's already good and has a foundation is like two different paradigms, right? Because you just can't get rid of something that's part of you, and anything that's part of you isn't bad. It's just something that works or doesn't work. So how do we make what works more?
Okay, that makes total sense. I wanted to dive in because I know you're an expert here. So I wanted to get in a little bit more specifics about pregnancy. I know that you see many pregnant women, and I know that there probably are some folks out there who think, oh my gosh, really? I can go for a chiropractic session with my stomach out, 7 or 8 months pregnant. I can't like really be comfortable on my stomach, obviously. Is
Yeah.
that something I want to wait to do till after I have the baby? And I know you use certain techniques too. So I was hoping you could kind of dive in there for us.
Yes. So pregnancy, if you look at it medically, it's deemed as a condition. And the way we view pregnancy, chiropractors that work with pregnant women and children in pediatrics is not that it's a condition, again, that it's a natural part of life, and that the more we intervene, the more difficult it becomes for the body to use its own innate intelligence to do what we were designed to do, which was have babies and
Love that
procreate.
you said that. I love that you said that because, yeah, we were designed that way, right? But with all of this information that's thrown at you, I think particularly with women who are pregnant for the first time, they're scared to a certain extent, right?
Yes. So again, chiropractic isn't doing anything to them, right? It's more about revealing what we already know is there and guiding women through that process with this understanding that they have the power, within their own bodies to have really beautiful natural births. And if there is an emergency, then you have access to emergency medicine, but to get out of the way as much as we can to aid the body to do what it already knows how to do, which is heal, evolve, grow, give birth, all those things, get yourself out of a disease process. And
Right.
we get stuck, right? We get stuck and then we get in fear and then things just halt because the body then goes into survival mode. And if your body's in survival mode, it's going to be a very difficult road for you, whether you're dealing with cancer or you're dealing with birth or you're dealing with chronic illness or you're dealing with just a daily stressful life. If you're in fear mode, you're actually shut down. Your system is shut down, and you can't be in a shut down system or a fear-based system folded in and closed up and evolving at the same time. Your
Right.
brain can't do that. It's going to either be, let me make you survive and live through this, right, which is the first priority, and all systems online for running away or saving yourself, or you're going to be in, I can create this life, my body knows what it's doing, and I'm healing and my body's evolving, and you're in a different part of your brain, which is allowing your body to evolve, open up, and express life. So how do we help? Not even get, I don't even want to say get, because we're not really doing anything. How do we enable the body to be in the mode of ease more than it is in fear and stress?
Yeah, and I know I've had you on where we've talked about that too, but I think we're what we're also want to pinpoint is that whole brain body connection, right? So you mentioned
Well, yeah,
stress and
right,
fear, and that's all happening upstairs, right?
right,
And
but it's
now
not,
physiologically our body is reacting to that,
it's not
right?
just in your head. That's the other thing, is women, this is really important, that as women, because we do tend to be run very emotionally, right? We have a lot of hormones that were designed to be more of a compassionate, sensitive, emotional, empathic, that kind of that's hardwired in our system because
Right.
that's who we are biologically. And so unfortunately, in this modern world, we then have to wall off from all that stuff to be able to get it done, because now we're working and raising children and running households.
Right.
So there's no space for that soft landing for us so that we can live through our intuition. We do have time to make the space to get into the mode of, evolving our pregnancy or evolving our life or creating stuff. So we'll hear, nothing's wrong with you, it's in your head, you're just crazy, you're neurotic, you're nutty, blah blah blah. And maybe not in those words, but it's implied, right? And I always tell my female patients, I tell all my patients, but mostly my female ones, because I have the equipment and I understand it, hey, this is not in your head, this is happening. Is it and I'll say to them, is it real? It's real, it's
Yes.
happening.
Yeah.
But can we look at it if it's true?
Right. How you're thinking.
Exactly. So
Yeah, I think when I said it's in your head, like this, neurologically, your
yes,
stress
yes,
impulses and your fears and your
wired,
anxieties that are triggered, right,
wired.
actually have physiological
Yes,
responses
it
in the
does.
rest of your body.
Exactly.
I guess I should have posed it more that way, but I
No,
know, but I'm glad you brought it up anyway, because it's
right,
true.
because
Women
right,
do get told that, you're too
exactly,
emotional, just relax,
in your head, you
nothing's
have
wrong with you.
you have anxiety. I was told I had anxiety my whole life, and yes, I did have anxiety my whole life, and I still do. And from having the anxiety my whole life, it basically seeded the soil I had for lots of disease and issues like breast cancer and that kind of thing. So yes, it was in my head, but it changed my physiology
Yes.
in order to be ripe to be ill and have sickness. So
Yeah.
it's how do we, so we know that it's the seed, the basis of it is how we view the world, if we're safe, if we're not safe, if we run on, fumes and anxiety, or if we run on, what's right with me and what do I build on from that, and then get the groundwork laid to be able to receive, you know ease in our system so that we can heal and evolve. And of course, in between all of that is it's not an easy task, but it's a worthy task. So when we talk, and I'm not going to go into the breath work thing because that's just one tool, right? But chiropractic is the foundation for putting neurological ease into the system so that it will go towards health and ease in the system. So why is that true? It's because, like you said, the brain. What happened to the brain and how is it wired from the beginning, even in utero, right? Even in utero, even maybe, on conception, what were the conditions in the mom's body to set
Yes.
up the neurology for the child's development? So, and again, without blame, we look at all of those factors pre-birth, pre-coming outside of the body. What are the conditions inside the mom's body to create the optimal conditions for the baby's birth? So
Okay.
even before pregnancy, we want to make sure that there's balance in your body, your female body, in the pelvis, so that you can have the optimal conditions for baby, carrying baby, the space that's needed for carrying baby in utero, and, and then the optimal birth process, because everything happens in sequence neurologically. And if it doesn't happen, it doesn't just go away, it goes deeper into the system and becomes a problem later in life.
So, I mean, you're a healer and you heal through touch. So I guess I'm wondering, with a pregnant woman versus somebody that's not with child, is there any approach at all that you do differently for
Yes, a
pregnant
much
women?
different approach, right? And I think one of the things people really need to understand and differentiate is there's chiropractors, just like there's doctors and lawyers and writers that have specialties, right? Just
Yes.
like, right, okay, so you can go to a chiropractor that does sports medicine, and maybe they'll have a few hours in chiropractic school on how to work with a pregnant woman. But again, you really don't want to go to a sports medicine chiropractor unless he said he's certified in, pediatrics or Webster technique or,
Okay.
neurology for pregnant women. Um, that's something that people don't understand so much, right? So a specialty is optimal, right? I think all chiropractic is great. And I didn't have a certification until I guess in the last 5 years, I've started really certifying. And then I understood the contrast of being, educated on how to work with pregnant women and babies and families versus
Absolutely.
it's a huge difference, right? And the way I do the care plans, the tables that I have, the things I have set up for pregnant women to be really comfortable on their bellies when they get
Yeah.
adjusted. The idea that you're not,
I just remember how uncomfortable I was, and my
yeah,
back with my son in particular. Oh, I
exactly.
had
I
horrible back
know,
pain the last 3 months and I was
very
having a hard
common
time sleeping.
and very common. So the tables design that I have are designed to optimally, keep that mom comfortable. And a lot of women will come into the office and say, oh my God, this is the best part of my day. I get to lay face down. I haven't been able to do that in months, and it's wonderful. And we really take care of them,
So
and we
they
take
are
care of
able to, because
oh
I've obviously never seen a woman who's,
yep,
quite
yep,
along that's been on the
exactly.
stomach for this type of
Yeah,
healing treatment. So
yeah.
that's
So
great that
it
that
is
you
great.
have equipment that helps them be comfortable in that
Absolutely.
position.
Absolutely. Yeah. And to be able to accommodate them so that they're so in ease just coming in and laying down. And if you've never gone to a chiropractor and you see the YouTube videos of the popping and the cracking and all that stuff, that's all fun and games, but there's so many ways to put ease into the nervous system and to make sure that that person can thrive and have the best birth possible, and then even beyond the best life possible.
I wish
And
I knew about this when I was pregnant,
a lot of people
honestly,
say
because
that. A
that's
lot
when
of
my
people,
body was just, I really carried in the front with my first child, and
yeah.
I could tell everything was off kilter, because
Yeah,
of the weight
you
in the
knew it.
front.
Exactly. And the way you felt. And like a lot of times people think aging it's normal to feel crappy as you age. It's normal. I'm pregnant. Guess what? We were not designed to feel not good in our bodies.
Yeah.
We were not designed to feel not good in our bodies. What now to get you out of that after all the years of, the imbalance in the structure in the body and the buildup of tension. Yeah, it takes a while to get that to unwind and come out and to get the balance and the integrity back into the nervous system. But when you do, there's no comparison to having a clear communication between the brain and the body. There's no comparison to the ease that you feel in your body. No pill can give that to you. You know,
Right.
if you need surgery, surgery, it's not even in lieu of surgery. Like if you need surgery, going up into surgery, being aligned and balanced makes a very successful surgery. Like it makes everything better. It's not in lieu of, it's part of. It's part of a healthy lifestyle. It's part of a balanced lifestyle. And then everything you do will work because
I
the
understand. I think
communication,
everybody listening understands that too,
yeah,
Emily. Thank you for
yeah,
that. We're talking about pregnancy and the hormonal changes and everything, but
yeah,
a big portion of our readership are gals going through perimenopause and menopause. And of course,
yeah,
I've been through that, some of the experiences, the mood changes with that, sleep issues, hot flashes, night sweats, just all those different things. Your body is like having these fluctuations.
yeah,
And so, going to a healer, to a chiropractic healer for those types of issues and getting regular alignments where your spine is working for you properly. Do you want to say anything about that specific
sure.
part of our demographic and those specific issues they're going through with menopause and perimenopause?
There's so many factors when it comes to women's health around menopause, menstruation, all of that. And again, it all ties back to what is happening with the system. So it's the groundwork of like, if there's issues, like say, even go back to really simple posture, right? If you're always struggling with your posture, if you always had like low back pain, if you, oh, yeah, and you always,
I
and
did
you're
think about sitting up straight.
right. And it's like not even your fault because your body, there's stuff in your spine, there's misalignments, and then, there's also that posture. So if you're uncomfortable, if you're in pain, if you're in, if there's an imbalance, right? Even if it's just in the spine itself, right? It always leads back to where we are going to land in, whether we're in fight or flight or whether we're in rest and digest and ease, right? What part of the autonomic nervous system are we landing in, right? And, how is our body responding to, are we having to be in protect mode or in, I'm open and free and comfortable mode? And that is really tied into women's health, menopause, menstruation, because the studies are showing that the more stress in the body, the more insulin that goes up and the more cortisol that's released. And what happens when that happens? everything hurts, joints are swelling, right? If you're having like hot flashes, it's going to be worse than ever, increased, right? Because
Right.
it's all the response of the body trying to get in regulation. How is the body going to regulate? So we mistake symptoms with something bad is happening to us, but it's really the body like trying to get your attention to say,
Yes,
we need help regulating this. Or
that's a
even
really good point.
exactly. So painful menstruation, 9 times out of 10, if you've always had painful menstruation, we can trace it back to subluxation in the lower back, right? Specifically, L4, L5 area, right? Innervating the uterus. And that tissue is very sensitive to any kind of neurological change, just like your gut is, right?
Right. That's
Everything
what
we're
I was just, it's so funny you said that, Emily, because I was thinking of gut health being central and also spine health being
yeah,
central to everything
nervous
else that
system.
sort of webs out from there, right?
Exactly. So you can trace it all back, right? And so I notice women who have painful periods and menstruation will then go into having a very difficult transition through menopause, because that system is driven by the nervous system. And if the nervous system is, I would say, is it toned? Or is it too much tone, or is there too little tone? And what we want to do is, and I'll go right to like the big muscle, the psoas muscle, which wraps around your whole lower back. It's the primary muscle that raises your legs up and down, right? And
Okay.
mood. And that's the muscle that gets really tight and contracted when we have our menstruation. So what I will do is I'll target that specific area on the spine where the psoas connects into, and will release and put ease into that big muscle. And once that gets released, women will say all the time, sometimes it takes time, but they're always like, I don't have painful periods anymore.
Because everything else inside relaxed.
Exactly. So now we're not tense,
Okay.
we're not pulling in, like you're not pulling yourself forward and in on purpose. You're not, your mom would always say, sit up straight. And it's like, but your muscles in your body weren't allowing you to, because you were in like a fold in posture because you were protecting. Maybe you had big boobs and you had to like hide those. Or maybe, you holding your shoulders back and being, face out in the world was threatening for you because people would make fun of you. Or we become very vulnerable expressing our full selves. So there's so many elements to that, and it wasn't your fault that you couldn't hold your shoulders back. It was your neurology that was protecting you so that you could do the first and highest thing, which was protect. That's
Okay.
life. You have to
Wow.
stay
Yeah.
alive. How are you going to stay alive in this difficult, challenging world? You have to protect you. And especially with women, I mean, it's heartbreaking because our boobs, we're face forward boobs. There's a reason for that too, to attract a mate and to get pregnant, right? So, the neurology doesn't align with having that big boob thing, right? Because it makes us roll in and go forward. We are protective. We don't like being gawked at, you know.
Yeah.
Absolutely need to come out in the world and be like, hey, boundaries. And here we go, right? We
Yeah.
fold in and protect. And now our mother says, sit up straight. And
Yes. Right.
now can we get a little compassion for
I
ourselves,
love your outlook, Emily.
right? And it's like
I love your outlook.
it's just punishing, punishing, punishing.
Yes.
So why are we going to come into the one safe place that I hope I provide for everyone? Come into the chiropractic office, and then your chiropractor is going to start pointing out all the crap that's wrong with you. And oh my God, how much stuff are we going to deal with? Oh my God, right? But why not come into this space and be like, listen, there's so many great things that are right with you. Let's focus on building up that connection between your brain and your body so that you can thrive. What does that look like? We don't have to rack and crack you. We can do many different things.
I
There's
think
so
a lot
many.
of people have that perception. So I'm so glad you brought that up a couple of
Yes,
times.
yes. And that,
Videos you see and
yeah,
maybe that's needed at some times, but
yeah,
from
and
just
it's
hearing from
great.
you that obviously you're a caregiver that looks at the individual, that comes across. So you're looking at the individual as a whole person. What mood are they in today? Probably even when they come in, right?
Yeah,
How you initially approach them and all of that.
of course.
So it's about a lot more than what a lot of people just envision
Right.
chiropractic,
And
healing
it's,
is.
it
Yeah.
is a lot more. And again, you have the right to pick the chiropractor that you feel the most comfortable with and does the technique that makes the most sense to you. So there's like, for as many, I don't know, there's probably even more techniques as there are chiropractors, right? And every chiropractor evolves through their technique as well, I would hope. And if a chiropractor isn't learning new things and getting certifications, then you're kind of with someone who's as stuck as you might be. So you want to make sure that whoever you're working with is evolving and, open to your feedback. It's a collaboration. Again, I'm not fixing you. I'm working with the best part of you to evolve, grow, and come into yourself in a way that's honoring of who you are and how you are. And we collaborate. We do ways to measure what we're doing on scans. We do neuro scans to see, are we making the progress we said we would? Are we doing too much? Are we doing too little? Is this technique right for this person? And so if a chiropractor can't pivot like that for you, and they don't have the certification to work just because they say it's not possible to work with a pregnant woman, or pregnant women shouldn't be adjusted. Some chiropractors might even say that, but they haven't been educated in what is possible.
So you
So
have to do your due diligence when
your
you
due diligence.
look for someone to help
Yes,
you, right? I mean, you
yes,
wouldn't go to a cardiologist to, fix your knee, right? I mean, it really is the same thing.
exactly.
It's
And again, right,
there are
right.
certifications
Yes,
and specific specialties in
yes,
your industry that
yes.
people can really focus on, and
Yes.
you should ask that up front, obviously, I
Yes.
guess,
And
right?
and if a doctor or a nurse or another chiropractor or a physical therapist or a massage therapist says anything to you that it's not possible or you shouldn't be adjusted, you should question that practitioner and being how up to date are they with the newest and latest and greatest of
Okay.
what is possible. Because any other practitioner that says another practitioner or another field of practice shouldn't be considered. They're not educated enough to know what the scope of that practice is for those
Yeah.
individuals. So that's a warning sign for you to know that you're not with someone, in your whatever field it is. I don't care if another practitioner says this chiropractic you don't, or it's going to hurt you, or baby shouldn't be adjusted, it's dangerous. They're not up to date with the latest and greatest of what's
Okay.
actually happening in the field right now for chiropractic. Chiropractic is going in a direction that creates sustainable health for people. It's a preventative model, and it is not emergency medicine. It is not a quick fix. You do not want to go to a chiropractor if you've broken your arm. You
Right.
go to the doctor and you go to the hospital, you
Right.
know, but if you actually have, you broke your arm and now you're out of balance, you absolutely want to go to the chiropractor. I have a lot of people who break things and they'll come to me before they go to the doctor to be assessed
Okay.
and balanced so they
Okay.
can handle what's going to happen next. I
Right.
have a lot of people come to me who are getting hip replacements and things medically. It's not in lieu of, it's in conjunction with to heal better and evolve.
Okay. I understand.
Yeah.
Emily, just very briefly, every November we focus on aging gracefully. We have a special issue called Aging Gracefully. And so, just briefly, are there any things like, later in life now as we mature and mature and mature and hopefully make it to a great older age, feeling somewhat good. Our bodies do, though, start to break down, right? We don't have quite the energy we used to have.
Right.
Our joints might be hurting, that kind of stuff. So, osteoporosis,
Yeah.
osteoarthritis, sleep
Right.
problem, just all of that. Is there anything you want to say about our more mature crowd and how chiropractic care can help them?
Again, would you want your body to work better and be able to age gracefully, then make sure that the neurology, the brain and the body are communicating, that you have full potential. I say power up, power on, all pistons going, right? In a good way. You're balanced, right? And like I can talk about, what that is till the cows come home. As you can tell, I always bring
Yeah,
it back
yeah,
to you. That's it. Nothing works without a sound neurological system
yeah.
that's communicating, right?
And that's across the
And
board, no matter what it
it's
is.
across the board for everyone.
Yes.
I've had people come in who have rods in their back from childhood, from scoliosis, and we're able to get ease into their system. And what does that actually mean? One of my patients couldn't open and close her hands anymore.
Oh,
She was doing everything. She was exercising, she was taking all the medication the doctor was sending her for anti-inflammation. She was stretching, she was going to the PT, she was, hot tubbing, whatever it is, she was doing it, right? And she never thought she could go to a chiropractor because she had rods in her back, Harrington rods in her back. So when she came in, I said, we don't have to adjust manually over those rods, but if we affect up here in the brain, right, we do the base of the skull and then we work with the base of the pelvis and the sacrum, and we can do dural and tonal work with you. And within 3 visits she was opening and
oh,
closing bars and doors, and the quality of, oh my god, the quality of her life, like what kind of, and the doctors were like, well, you have to stay on this medication, and she's like, no, I don't, because that was lowering the quality of her life as well, because it was
yeah,
affecting her, she was tired, she was affecting her gut, she's like, no, we corrected the cause, like we went in and put ease into the nervous system, so now my body's communicating and I can open and close my hands again. So you're talking about so many things that are affected by things working. And even if like you have a reason why someone said you couldn't be checked by a chiropractor, there's so many ways to be checked, there's so many ways to be adjusted. You just have to find the right person that you want to work with. And aside of chiropractic, let's push that aside for a second. What can you do? Always the simplest basic things are the ones that are going to give you the most. I it's so I the older I get, the more I realize, like, drinking water, not getting dehydrated, getting out into the
I've
sun.
really worked on that because I didn't used to drink water when I was in my 30s at all.
You don't want to feel uncomfortable in your body. You learn what it feels like to be hydrated or dehydrated. That's a
Yes.
foundational thing, right? Just like the nervous system. But if you're not hydrated, how are things going to work? We're 78% water. It's like not putting oil in your car, like
Yes.
nothing works, right? And then sun, get out in the sun. How are we getting vitamin D? We've got makeup on, we've got sunscreen on. Now we're getting cancer because of, because we're vitamin D deficient, and that's a primary hormone driver.
You got
High
to get out in the sun. It's a mood lifter too,
it's
right? I
serotonin,
mean, COVID really affected
it
people because
really
they were in
did,
their homes and couldn't go anywhere. And a lot of
right?
people's vitamin D numbers just plummeted, right?
And if your vitamin D is low, I promise you, nothing else is going to feel good. You're not going to, it makes your mood well, right? Serotonin. It makes you have, a balanced nervous system, joint pain, vitamin D and water, big, like 50% of your discomfort will be addressed, just with those two things. And then I've got this amazing, I don't know if I should do this or not. I think I should. This is called the Aura Ring. You want to figure out if you're sleeping, how your stress levels are, like I'm just learning all the implications of this, and then you can actually gain control
Yes.
of what's going on with you, right? Did I sleep really well last night? And do I have the reserves today to do the things that I want
And
to
then when
do?
you don't sleep well, you can understand now why your body's functioning the way it is that day, why
Exactly,
you're
exactly.
sluggish, why you feel like you want to go take a nap,
Right.
you
And
know,
so the big
why
thing
you're not on your memory game or you're not
exactly.
thinking on your feet, all those things, right?
Exactly. And to be kinder to yourself too around that. Like, why would we push and push, like, and do a heavy, heavy workout that we do every day, no matter what? So it is about flexibility. It's about compassion for yourself first, honoring where you're at, and then building on what you already have, what you have control over. And you have control over your lifestyle and how you respond and all of those things. And we can, so chiropractic will give you that foundational autonomy and sovereignty over your own body. Like,
I think it's, I
start
just,
from there first.
you know what, Emily, I know that most people that listen to this and other shows you've been on understand your philosophy, but I was hoping before we close, you could just maybe give us a message. You usually do that for the women out there. Sanctuary is all about supporting women. And so do you have anything you want to say to the community before we close?
I have so many things I want to share. But I'll read a quote that I have up on my wall right now because this is what I'm
Oh, I
working
love it.
on. And it's about integration.
Okay.
Right. It's not about fixing anything. It's not about taking out. It's not about putting in. It's about integrating what we already have. It's about finding a middle ground, facing the fears, feeding the tears in our narratives, and becoming whole again for a lasting change.
I love that. I love that. That's yes. And really take that in and move forward with that, with those messages. That's wonderful. Thank you. Emily, I could stay on for another hour with you,
I
but
know too. I love
unfortunately, we
doing
have to
this.
sign off.
I
But
love
thank
doing
you
this.
so much, really. Thank you so much. This was an incredible show.
Thank
And
you.
I think you've really given people a good perspective on what you do and how you heal and how to help others heal and take control of their health. So thank you so much for joining me today.
I do want to offer
Yes.
anyone who does want to find a chiropractor that is a good fit for them. I do invite you to connect with me either email or on phone. I will find you a chiropractor where you are that would be a good fit for you that
And you
has
know
this.
what? We'll put that information up
Yeah,
right
I would
now
be
so
happy
that
to do
everybody
that.
can see that so they
Yeah,
can contact
yeah,
you. That's
yeah,
terrific. Thank you.
yeah. Okay.
Okay, I'll sign off as I always do by wishing all of our listeners and our readers good health, happiness, and continued inspiration. Thank you so much for joining us today.
Thanks, Myrna.